It's a wonderful question. Thank you, Dipti. And a much required question as well, keeping today's scenario in mind. What I've seen is that most of the healthcare system which is in place now or which is imbibed on our minds is a reactive healthcare. That is, we only go to doctors or we only approach doctors when we fall sick. Preventive healthcare probably is a practice in our lives, but that's not to an extent as to make a larger impact. So COVID has knocked sense into many of our minds, as in why boosting immunity is important before you contract the virus, etc., etc. But we need this on a much larger picture, especially in women. The reason is that in several surveys conducted, for example, I vividly remember one survey conducted by GCI, in which they asked over 500 employees as to what was a major health concern which they were not addressing, and one of them was stress. The power which our mind has over our body is tremendous, and many of the diseases, although not physical, can be triggered because of stress on our body, which manifest as physical ailments, and several of them are not reversible. For example, I would give a quick example of polycystic ovarian syndrome, which is another silent pandemic that nobody is addressing, which women are suffering from today. PCOD or PCOS, as we call it, doesn't hamper your day-to-day life. You have irregular periods, you tend to gain weight. Some of us might experience issues related to our fertility levels or related to acne or related to hair loss, but none of which make us sleep in bed, isn't it? So we tend to address such health issues only when it becomes unbearable or unmanageable. But if we have to proactively look at ourselves and identify that, oh, this tiny symptom that my body is showing me today could kind of snowball into a very big disease tomorrow, and I need to take steps for it today, that kind of a mental conditioning is non-existent. Whereas Ayurveda, being a holistic science, advises that reactive healthcare is becoming redundant as we are progressing, as the time is progressing. And our healthcare now needs a major reform in terms of being a proactive or a preventive healthcare, wherein we start training our children or ourselves in whatever stage of age we are right now to take steps, identify what am I prone to, what diseases can happen in future, what is my genetic tendency, what have I might inherit, and what genes might become, may code for diseases in future, and take care of that right now. So it is definitely in need of an hour, especially for women, for everybody, but especially for women.